Hi, my name is Christy Drake, and today I'm going to be discussing the topic of caregiver burnout among nurses and hospitals and what we can do to stop it. So, what's the problem? Caregivers are becoming emotionally, mentally, and physically burnt out after taking care of ill or chronically ill patients for an extended period of time. This can include relatives or patients in the hospital, things like that. 98% of caregivers feel lack a sense of personal accomplishment. 66 of those feel depersonalized towards their patients, and 57% of them feel emotional exhaustion just from their everyday activities that are so mundane that they do over and over. Burnout is causing nurses to provide inadequate care due to the feeling of being disconnected to their patients. 95% of nurses feel that the burnout has affected the care that they give their patients. 7% feel disconnected from their patients in general, and 37% felt that the care that they were giving was inadequate overall. As you can see from the chart that I've listed above, that the feeling of the burnout that they feel is negatively affecting their patient's care is the highest ranking on the list. Turnover rate among nurses is also a big problem caused by burnout. The 2018 National Healthcare Retention and RN Staffing Report stated that RN turnover rates have increased with an overall vacancy of 8.2% as of January 2018. The staffing report also stated that registered nurse turnover rates have increased to 17% over the last year. The first chart on the left side of the screen that I've listed, you can see that the vacancy rate is there at the 8.2%. Certified nurse assistants, which are they just kind of aid in helping nurses do their everyday tasks. So they tend to do a lot more of the heavy lifting than some of the nurses do. Their turnover rate is a lot higher than just a regular nurse, with the overall bedside nurse turnover rate being at 17%. The cost of turnover in bedside nurses for a hospital as of January 2018 can be up to $61,100 based on each nurse. So each nurse is going to cost the hospital $61,100 to replace if they quit and then are replaced. The overall cost for an RN turnover based on the percentage of turnover can be up to $5.7 million, with each percentage costing the hospital $337,500. So each percentage of nurses in that 17% is costing the hospital $337,500, which is extremely high. And they're relating this to the burnout that the nurses are feeling. So what can we do to fix that? We can lower patient to nurse ratios so that there are less patients that nurses have to take care of. We can offer stress management training and cognitive behavioral therapy. Lowering the ratios will offer more time with patients and nurses. They will likely feel a little bit less overloaded with their responsibilities. Currently, nurses are caring for 5 to 7 patients in their average 12-hour work shift. That's according to a nurse at Carolina's Medical Center, Sarah Freeman. The goal is to lower the ratio to about 3 to 4 patients per nurse, to decrease error and exhaustion among those nurses. Stress management training will provide nurses the techniques to handle the heavy workloads and the daily demands and give them techniques to be able to handle that. Cognitive behavioral therapy can offer nurses the opportunity to express their frustrations. It's more of like a mental health type of thing, so that they don't feel overloaded and they can learn techniques to work through their emotions if they're dealing with a very sick patient or chronically ill patients and things like that. So how are we going to do this? How are we going to implement those solutions? We can lower the patient to nurse ratio by hiring more nurses to cover the overall workload. The stress management and cognitive behavioral therapy, that can be done through one type of worker, which is a licensed clinical social worker. If we can hire 3 to 4 per hospital, that can possibly cover the majority of the nurses that are feeling overwhelmed and give them a chance to be able to talk about their frustrations. A lot of nurses are going to find that unnecessary, that they don't want to talk about their emotions. So there's no need to hire like a licensed clinical social worker for every department, maybe just 3 or 4 per hospital. That's based on a hospital that has 1,229 hospitals, which is like the one at Carolinas Medical Center in Charlotte. The average cost of the recruiting and hiring process for one nurse is $10,000, which is significantly lower than the $61,000 it was if you lose a nurse and have to hire another. So hiring them brand new is much cheaper than losing one and having to hire another one. The cost of losing a nurse and hiring another one, it can cost anywhere between $42,000 and $64,000, so it's roughly that $61,000. Evaluating the effectiveness of this. We'll take a lot of surveys from nurses and other caregiving staff. We'll also take into consideration the other stakeholders that are involved, such as family members, hospital staff, kind of see where everybody's feeling and if these techniques are working for them. As far as the patients, we can see their satisfaction. Do they feel like they're being cared for better? Do they feel happy with their care? Does the family members feel like the patient's getting better care if there's more time spent with them from the nurses? At the end of the year, we can do a financial analysis to see if the money that we've spent on hiring new nurses and licensed clinical social workers, we can see if the overall amount of revenue brought in from patient care is going to exceed that of what we spent to hire the additional staff. Overall, all of those factors together, we'll be able to kind of get an idea if this solution worked really well for the hospital. If there are more patients that are entrusting in their care at the hospital, the revenues will increase. So that will be able to cover the cost of the licensed clinical social workers and the nurses as well. And with all that being said, I hope that we can handle everything as far as caregiver burnout and maybe make it a little easier on nurses so that there are less of them leaving the profession or not going into the profession at all, and that we can boost patient care because that's overall the most important thing. Thank you.